If you were to be just getting started, are there ones that you think are more gentle, or do they serve different purposes? Like like you mentioned couples with MDA or MDMA, like if I have OCD or anxiety, is there one that you recommend? Or if I'm trying to fix like childhood trauma, is there one, I guess, are there different levels and strengths, or do they hit different parts of you? How does that all work?
Yes, and yes. All the above. So I think if you're listening to this and you're thinking, oh, well, I'm curious to start and I'm not sure where, I think I'd ask you back, like, well, what's drawing you? What's speaking to you? What are you resonating with? And maybe there's something just in that energy exchange right there that's something worth paying attention to. Certainly if you're saying, okay, I want to open my heart. I'm looking for a heart opener because I want to feel more love towards myself. I want to feel more love towards my partner. MDMA or MDA or sassafras, same thing, is a beautiful place to start for that. It is you can't help but feel love. Quick note on that with people with post-traumatic stress disorder or treatment-resistant PTSD, where the existing talk therapies and pharmacological solutions don't work. Phase 3 clinical trial, after 3 sessions with MDMA, 67% no longer qualify as having PTSD. So super cool, super,
wow.
Really, really powerful medicine.
Wow.
Really powerful medicine. Mushrooms seem to be a place that a lot of people choose to start. It's very grounding. You talked about having your feet on the ground earlier. You feel very connected. You look at least in my experience, you can look at nature and see it differently and closer than maybe you have it previously. For me, it was the first time that like this idea that we're all brothers and sisters, like, oh, wait a minute, we are all brothers and sisters, and feeling it differently than the intellectual exercise or than just the reciting the trite thing you heard growing up. So I think psilocybin is gentle in a place that a lot of people start. Some people are drawn towards ayahuasca. They want for whatever reason to go to the jungle. They want that energy that comes with ayahuasca, and it is not as gentle. There's a physical purging. You typically throw up at least once during the ceremony, but that's not as bad as it sounds.
Sounds terrible.
I thought so too.
Sounds terrible.
You know, it's funny. The first time I was doing ayahuasca, the shaman's wife said, "So you're really scared about the throwing up?" I was like, I hate throwing up.
Same.
And I was like, I really hate throwing up. She said, "It's going to be the most beautiful part of the ceremony for you."
Oh.
And I said, I don't think so.
That actually makes me more nervous. Like that's the highlight.
Well, it's one of them in a very different way. So it's when you purge, or at least for me, when I purged in ayahuasca, it is you are releasing something out of your body, and you can look into the bucket, as gross as that sounds, and you can see what you released and go, oh my God, I didn't know I was carrying that. It sounds wild. So I'd say one that I can remember is I purged that I had I looked down upon people who said they spoke in tongues. And I'm looking at the bucket, I'm like, oh, I can see that. Clearly, I do. I thought that was nonsense. But meanwhile, I had like an hour discussion with an alien just a minute ago. It felt very real to me. Here I am looking in the bucket like, oh, okay, maybe I shouldn't judge people like that. Maybe that's another form of just yet one more way that I judge people. So I was like, okay, that was a good learning. But no, there's some beautiful parts in ayahuasca. The DMT component of ayahuasca is so visual and so beautiful, and you can all sorts of galactic. So as grounding as psilocybin is, ayahuasca can be galactic and can give you just a whole different perspective on the world, and thinking in terms of millions of years versus lifetimes, and just so much farther out perspective. If I had a child who is having a heroin addiction, or if I had someone I love struggling with an opioid challenge, ibogaine is the solution. It's doing incredible work. There's a Dr. Gabor Mate up in Canada who is really doing incredible things.
His son's coming on the podcast
in
February. Yeah.
Oh, that's so cool. All right. So also on trauma.
Yep. He helped write that Myth of Normal textbook that I got to digest before he gets here.
Yeah, he's such a such good work. The Wisdom of Trauma is his last, the documentary he just had come out, which is beautiful.
I haven't seen that one yet.
Totally worth watching. And then he has, I think if you pay on his website for that, there's all these, like, I don't know, 30 hours of additional content around trauma.
Wow.
Super fascinating. And then the work with Ibogaine is just, I mean, there's very few things that if you have someone who's trying to get off of an opioid that work like Ibogaine. Again, disclaimer, it is a serious medicine. You need, in that particular psychedelic, you want to have cardiac monitors. You want to be in with medical help nearby. It is something you can die doing. So it is not like these other medicines, but it is, if I had someone who I loved and everything else was not working, 1,000% I would get them to a legal clinic or gray clinic, as they are in Canada.
Isn't ayahuasca, can't you stop breathing on ayahuasca?
I don't know the answer to that. I have not heard that. I know there's respiratory things, and I think there are respiratory issues with a few of them, but again, in the scale of probability, these medicines are safer than a lot of medicines that are illegal. So you can overdose on Tylenol. You can overdose on alcohol. Happens daily.
Yeah.
You can't overdose on psilocybin. You can't overdose on LSD. And again, you get hooked. So yes, all these medicines should be approached with reverence and with respect for it. These are medicines, and these are a lot safer than things that we've been taught are safer. Just not true.